So, my name is Cathi Spooner. I'm a licensed clinical social worker and I'm a registered play therapist supervisor. I I actually started in the field back in 1992 when I graduated with my master's degree in clinical social work. I I had been introduced to play therapy when I was a special education teacher back in the 1980s, like mid 80s. And I worked as a special education teacher outside of the Washington, D.C. area in Virginia. And we had a self contained classroom. We had a school psychologist and a school social worker. And I was in an elementary
Mhm.
school for children. Our center focused on children with emotion problems. It's a horrendous term for it called
Mhm.
emotional disturbance, which I still find they're still using it. It's atrocious.
Mhm.
Anyways, that's what it was called. Kids who couldn't stay in class because of their emotional
Mhm.
problems. And so they were doing this thing back in the mid 80s. They were so excited about this play therapy thing that we're doing. And I'm like this young 20 something teacher
Mhm.
just trying to get it figured out to have the kids stay in the classroom and not get dysregulated
Yeah.
so that they could learn. And long story short, the school psychologist did a play therapy group with me with my class, which is where I was introduced to play therapy. And I was sold. I just saw such a difference in the kids. I saw right afterwards the way they were with me changed. So that was kind of the catalyst to going back to school and getting my master's degree and graduating in 1992. But it's kind of before the internet,
Mhm.
and there was no way to find out where these play therapy things were. So I just kind of muddled along and got it figured out. I'd always, even as a little kid, wanted to work with kids and wanted
Mhm.
to help them heal. I just didn't know what this counseling thing was until I got I got into it. And so it's something I've always wanted to do, was help children heal. And then that's
Mhm.
kind of how I stumbled into play therapy and eventually finding where to get this done and getting my registered play therapy credential. And I've been in the child and adolescent mental health field for almost 35 years now. Play therapy specifically, almost 23 years, coming up on
Mhm.
23. Yeah, right now I do a lot of training and consulting, teaching other child and adolescent therapists how to do play
Mhm.
therapy. So I have some online memberships and consultation programs and trainings that I do to help people learn how to do play therapy.
And obviously, in this world, play therapy is really popular. But for outside looking in, play
Hmm.
therapy. I mean, now I think therapy is obviously more talked about, it's more well known. But I'm
Right.
assuming earlier on in your career, probably like the same looks of like what
Yeah.
play therapy.
Yeah.
How what is that? So I guess when you were introduced to it, did you have the same like curiosity around like, well, can you actually use play? This is more at least
Yeah.
early times, not as traditional when people thought of therapy. And I even think now when I'm talking to parents, play therapy was not something that comes top of mind. How do you, I guess,
Right.
navigate that or understand like, okay, well, I see in the use case here, was there specific examples where you saw the, silly as it sounds, the power of play and realizing, okay, for at least for the youth, especially, it unlocks something that maybe the classic talk therapy mind track is not as effective just because kids can't communicate as effectively, especially when they're younger.
Yeah. Play therapy actually has been around for a
Mhm.
really long time,
Yeah.
going back to the Anna Freud days um, and kind of that era.
Mhm.
I think it's become more widely known. I would even say play therapy has become kind of like the go-to
Mhm.
model and to use with children. And there are even some play therapy specific models that are considered evidence based.
Yeah.
by SAMHSA. Um, I would say where I discovered, like, going back to when I was a
Mhm.
special ed teacher, the school psychologist one time, a
Mhm.
couple of times, like, she'd taken one of the students from my classroom into her office and they had done this play therapy thing.
Mhm.
Like, I'm a 20 something kid
Mhm.
who doesn't really know much, but I think I know a lot.
Mhm.
And
Yep.
she's so excited and she shows me what my student had done in her office with blocks. And she's like so excited. And in my head, I'm looking at it like, she's really excited about this, but I
Yep.
have absolutely no idea why she's excited. But when I did the group with her
Mhm.
and I saw how play
Mhm.
actually facilitated healing, that's when I would say I had that moment of, oh my gosh, there's something to this thing. And it's actually kind of fun. And so I would say that's kind of where I had that moment.
Mhm.
And then over the course of my career, just using play therapy, getting trained in
Mhm.
it, using it, and actually experiencing the difference. Like, I remember when I was fresh out of grad school and nobody knew how to do play therapy, and my supervisors were like, they're kids, you'll,
Mhm.
just pull out a worksheet. And the thought of doing a worksheet made me want to gouge my eyeballs out.
Yeah.
And the kids would look at me like, this feels like school. And
Mhm.
then we would do these other kind of play-based things, and I got more traction with that. So, we talk about play therapy, but it's one of those things you're like, how does just playing
Mhm.
move the needle for healing? And
Yeah.
from a play therapy standpoint, the Association for Play Therapy defined play therapy as the use of a theoretical model to access the therapeutic powers of play within the context of a strong therapeutic relationship.
Mhm.
So, the way that I break that down to help people understand what
Mhm.
play therapy is, play therapy, like talk therapy, is theory based. So when you go for traditional talk therapy, they're using a theoretical model to help understand what the problem is, what are the roots of the problem, and how do you help clients get from the beginning of treatment through all the stages to where they feel better. So it's theory based, and we use what we call the therapeutic powers of play,
Mhm.
meaning children engage by playing. They
Mhm.
engage in relationship, they do problem solving, they figure things out, they try out different roles. There's tons of research even on the use of play helping children learn. And so if we harness those therapeutic aspects of play, then our theory model is going to help us know how to help children access those therapeutic powers of play, but they're not going to be able to do it unless they feel safe and they feel comfortable with this new adult. And what are how and that therapeutic relationship is really what helps them feel safe to engage in play. And you can actually see what's going on with kids
Mhm.
through their play when they're in that therapy space.
In I think that's what's like really powerful about it. Like you said, the expression, allowing them to see and not feel. I mean, the classic thing like you touched on is for any therapy to work, you have to have a rapport and a conversation. So not that
Mhm.
therapy has to be fun necessarily, but they have to
Right.
most of the time participate in it.
Right.
Obviously, since you've been doing this, the tools, what's accessible has changed. Like I'm making an assumption. I'm assuming video games early on in the career wasn't a common thing. Now, if there isn't some tie into digital, or at least whether you're using digital or not, this is more of a common medium or at least interest. Obviously, new tools came out, new things of popularity came out. When you're evaluating new tools to bring in, because obviously there are things that a child
Mhm.
or a patient may love, like, okay, I'm really connecting to this, but there has to be some connection to therapeutic outcomes, or at least some way to use it within your practice. How were you able to evaluate these new tools, especially when from my experience, I mean, I have a toddler, so I'm not there yet, but their world is so
Right.
much different. So when I'm trying to connect to them, most of the times, these are new things that I might not be an expert in. So how are you able to say, okay, new tools are coming out, I could use this in practice versus, okay, I need to evaluate this a bit more. How are you able to balance the connecting with what's relevant, while also being therapeutic?
And I think that's, as a profession, as a play
Mhm.
therapy profession,
Mhm.
since COVID, where we were all kind of catapulted overnight into
Mhm.
doing things differently, I think play therapists are trying to sort that out.
Mhm.
And previously, I would say prior to COVID, there were not very many play therapists
Mhm.
using any kind of digital devices. There might have been some here and there just because they they really are drawn towards
Mhm.
the elect gaming and things like that, and trying to figure out how to bring that into the play therapy space. When
Mhm.
COVID came along, and Zoom wasn't quite cutting it, especially if you have a 5-year old
Mhm.
on the screen. What do you do with that?
Yeah.
And so, what began to happen is, because I do a lot of consultation with play
Mhm.
therapists, and these are the conversations that we have as they had to begin to grapple. How do I help my clients when I can't see them in person? And then we've continued that because we've gotten used to doing that, especially in Nevada where I live. There are a lot of rural areas where they don't really have access to mental health, and telehealth has become a way to be able to reach people who previously were hard to reach. And so, what play therapy, I think, as a play therapy profession, we've begun to figure that out. Like, how do we create an online space for setting up virtual playrooms where we have access to different things? And most of the way of trying this out is just trial and error. As therapists, I think part of it is what what are therapists comfortable with, their level of comfort using technology. We have not been a particularly strong community in the technology area, and I think that's changing. And so, trying out different online platforms, trying out different ways of therapeutically using online gaming, and how can we, because the children, that's their language these days. They grew up using a lot of online games. So this is their world. So if we're tapping into their world and we're trying to understand what's relevant for them and how can we tap into these therapeutic powers of play, then I think as a profession, we're beginning to explore those areas. But for now, I think it's primarily trial and error, people sharing resources, kind of what's worked, what's not worked.
Yeah, it's very, like you said, very community based on what others are doing, and kind of growing as a profession and as a community of like what other tools are people using. I think that's what's so important about this, because
Yeah.
your experience, even if you have a lot of clients compared to the masses of people in this profession, it's one sample size. Um, Obviously, you know, again, it's the adjustment. I think it's always safe. It's always, as you know, it's always better to be safe and think things through, because you're working with a vulnerable population, but also it's therapy. It's not a, you can't. It's not like a project you're maybe doing in a school where there's no consequences
Right.
with
Yeah.
one thing that's always interesting, and obviously when I'm talking, even through my work, and people ask me what I do, is parents are also very interested. So when a parent says, "Hey, my child came home and says you're playing in therapy, what's going on?" I'm thinking it's a very common question.
Right.
You have to reply to that, 'cause it's probably
Yeah.
something that's very often happening. Yeah,
Yeah. Or they look at you like, why am I paying you to
yeah.
play? Um, oh, that is something we talk about a lot
Mhm.
in with the people that I do consultation with. in my, especially my
Mhm.
kind of higher tier
Mhm.
consultation program, is how do you explain play therapy in a way that accurately articulates
Mhm.
what it is and why it is actually therapeutic.
Mhm.
And I, I think a lot of that is really getting comfortable and recognizing it is theory based. Play therapy
Mhm.
is theory based.
Yeah.
I'm going to use a specific play therapy model. I'm going to learn how to use that play therapy model, because that's a lot of what I teach people to do is how do you use your play therapy model and allow that to guide you through. And once they understand how to do that, then I think we become better at explaining to parents, here's what we're doing and here's why we're doing it. Like when I meet with parents, when I'm
Mhm.
doing therapy with kids and
Mhm.
I meet with parents and we do the psychosocial assessment and get all that done, and I'll explain, I'm going to I'm going to meet weekly with your
Mhm.
child. I'm going to use a theory model called child-centered play therapy. It's going to look a lot like we're
Mhm.
just playing in session, and I'm going to talk funny with your child,
Mhm.
and it's actually based on a specific theory. I'm going to be looking at what's going on in the session, how they're interacting with
Mhm.
me, how they're interacting with the toys. I can tell what stage of the process they're in.
Mhm.
I'll explain the stages of child-centered play therapy to them,
Mhm.
and I'll kind of match it up with what that would look like in traditional grown-up talk therapy
Mhm.
to help them make sense of it. And so I think once we can articulate how the theory is applied, then they get more comfortable with that.
Yeah. And that, I mean, I think that makes a lot of sense. I think it's like anything else, just on the education front, being like, this is what's actually going
Yeah.
on. There, it's, it's based in practice. I guess
Mm-hmm.
one thing, I mean, this was such an interesting conversation, just hearing your experiences, seeing how it's changed over the years.
Mm-hmm.
When would with the, I guess, I don't say popularity of therapy, or at least with more and more need for therapists and it being more of a common talking point, I guess the classic thing I get asked from a lot of people, especially individual I mentor, is, I want to get into this field, or I'm interested in this field. And I'm assuming you probably get something very similar. It's what
Mm-hmm.
it sounds like. What advice would you give someone trying to enter this field? Because I think there's obviously such a big need. People are realizing, okay, I want to help people. This is a great way of helping, especially if you work with youth. I know many of my friends who were initially um, counselors or within education have moved into the therapy space to kind of do that as a
Mm-hmm.
profession. What have you been those talking points of people looking to enter this as a field as professional, maybe based on interests from the past?
Yeah. I actually have those conversations a lot with people.
Mhm.
I think one of the things that I usually start out talking with them about is, what is it that you want to do? There's a lot of, in mental health, there's a lot of different
Mhm.
ways to go about helping people. That's not necessarily therapy, what we consider like counseling. So is it the counseling part that you want to get into? What are your goals? Like what do you want to be doing down the road? And then helping them figure out, well, you have to get your master's degree. You need to make sure it's
Mhm.
this specific kind of master's degree. Here's the questions you need to be asking the university program people to make sure it's going to get you where you need to go. And then you're going to graduate, and then you want to make sure that you get a supervisor and a placement that kind of lines up with what you're interested in, and make sure to ask about the supervision and what kind of supervision, because there's licensing and you have to make sure you're clear
Yeah.
about what type of job is and what type of supervision is going to meet the state requirements, because in the United States it's a little different in Canada,
Mhm.
but in the United States the jurisdiction overseeing is the state. And
Mhm.
so like kind of walking them through what they need to be looking at and looking for, and then um, making sure they know what questions to ask as they're going down that process.
Yeah, I think that's an important thing, because I think one thing with any profession is there's a jurisdiction, especially Canada specifically. Is like, certain provinces in the states in network out. Like, where do you want to work? What profession do you want to go? Psychology, social worker. Where do you want to
Mm,
focus? I think that's something to always consider, because it's like anything in life. You're like, I want to do this. Then so how do you work backwards to say, okay, where actually? It's a very broad career path. Where do you actually end up? But no, it was so great kind of chatting, hearing your views on this. I guess to end off,
mhm.
any not words of encouragement, but anything. I guess this is a great question to end off. And what are you excited for? With, I mean, at least on more on the positive end, what are you excited for in the future? You think can either be not solved, but like we're moving in the right direction on? Are you excited to kind of see the progression over the next 5 years, where you think there can be a big impact if anything comes top of mind?
There is something that comes top of mind. I would say, and I would say this is kind of my hope for the play therapy profession in general. Traditionally, play therapy has been individual counseling and kind of check in here and there with parents. In my mind, because I have more of a family systems foundation, that's back in grad school, that was the theoretical models I started out with. So I think systemically, and when I think about children, I think we have to think about children in context of families. And if we're thinking about children in context of families, then how are we supporting parents? I think
Mhm.
parenting, with all of the bombardment of social media and the internet and 24-hour news cycles freaking people out, they feel stress. The kids feel the stress. People are working. Um, Finances are hard. My hope is that we begin to think contextually when we're working with children. It's like I have a family play therapy model that I developed a while back, and so at some point in time I'm using family play therapy. I'm getting the parent in there. I might be getting all the kids in there with different versions of the family, but reestablishing and strengthening those attachment relationships. Because in my mind, when we strengthen the relationships between parents and their kids, the long term, even generational impact of that, helping families shift generational patterns, maybe of dysfunction or histories of things not going so well. If we can facilitate and help parents become those therapeutic agents of change, so to speak, for their kids, then that has much more long term impact than if I just see their child every week and touch base with parents here and there. I think we need to focus on really supporting parents to help them know how to support their kids and to clear out the noise and figure out what the heck to do about social media.
Yeah, that I think that makes a lot of sense. It's for sure some of those things now we hear more and more. Obviously, as you know, with Australia
Yeah.
banning social media, we're seeing some change, or at least realization of the importance of this. But again, I just wanted to end by thank you so much for taking the time and kind of sharing your experiences, and look forward to following your journey more along more as well. Have a great
Yeah.
day.
Well, thank you for having me. That was
Bye.
awesome to be here.